Leptospirosis is a relatively rare disease, usually found in northeast New South Wales and Queensland. However, recent outbreaks in Sydney that have claimed the lives of a number of dogs have experts concerned. Christine, what do people need to be aware of when it comes to this for dogs?
Yeah, so leptospirosis is a bacterial disease and that's transmitted through mainly rats and other rodents and transmitted through the urine of these animals. So dogs at risk are dogs that are first of all ratties, so that will catch rats and maybe eat these rats, or dogs that are in contact with rat urine. Rat urine can actually survive for quite a long time in moist environments. So that's why we usually see leptospirosis after periods of heavy rainfall. So it will then just be in puddles, for example, or in little ponds or lakes where these dogs maybe are drinking from or swimming in. And most importantly, leptospirosis is also a zoonotic disease, which means that humans can also get infected.
Right. Is it serious?
It can be quite serious, and sadly in the Sydney cases that we have seen so far, the mortality rate was 100%. So all of the dogs died or needed to be euthanized because of very severe complications. And that's quite a huge difference to all the other cases that we are seeing worldwide.
Right, okay. And how common is it?
From May 2019, we had a lot of cases. Talking about a lot, it's been 8 cases, but we had 1 case every month during the year. Wow. And that's quite rare. So there's a huge concern that this disease is actually, first of all, making a comeback, and we don't really know why. And second of all, it's quite fatal for all of the dogs infected.
Since recording this interview, 4 more cases have been reported in Sydney and another in Melbourne, highlighting the ongoing need for dogs to be vaccinated against this deadly disease. Fortunately, one of the dogs did survive.
So initially they might just be a little bit lethargic, stop eating, develop vomiting, diarrhea or fever. Then ultimately they can become really, really sick. So it's very important that the disease is recognized very early on though.
How is it passed on to humans?
To humans it can be passed in the same way as to dogs. So again, rat urine or urine from infected pets can actually be a source of infection. Leptospirosis can penetrate intact mucous membranes and also like little skin wounds as well. So that's why it's very important if there's any concern that a pet might actually be infected with leptospirosis to not touch mucous membranes, like wash their hands after handling the pet. Be careful if you have any little wounds or anything like that.
Symptoms in humans can range from mild flu-like symptoms to kidney and liver failure, making prevention all the more important.
If you know that your dog is maybe a ratter, try to prevent that from happening. And similarly, avoid going to parks that might be at risk. Don't let the dog drink out of puddles as much as possible in these parks. And then there's a vaccine available as well. So I would just, if you are concerned at all, talk to your vet and they can discuss the pros and cons of vaccination with you.
If you're living in an area that might be putting your dog at risk, have a chat with your vet. Thanks, Christine.
My pleasure, Morgan.
That's good. I'll make sure I don't drink out of any puddles.